In this video, we will be discussing the arterial supply to the pelvic limb in a cat. We are going to start up here in almost in the abdominal or pelvic cavity with the external iliac. From that external iliac, the deep femoral artery will arise. Cats normally don't have a PE trunk, but this cat decided to have one, which is okay. So, pudendo-epigastric trunk, and we'll talk about those vessels later on in the semester. The continuation then of the deep femoral after the PE trunk is called the medial circumflex femoral. Once the deep femoral arises from the external iliac, the name changes on our main channel to femoral artery. As we move down the femoral artery, there are some broken branches here in this cat, which is okay, that come up underneath the sartorius muscle, and they would have been superficial circumflex iliac arteries. If I elevate that femoral artery, I can see a lot of branches coming off and going between the rectus femoris and the vastus medialis, and that would be the lateral circumflex femoral. Very often in a cat, the superficial circumflex iliac arteries and the lateral circumflex femoral will all arise from a common trunk. As we then progress farther down the femoral artery, we're going to be looking for our proximal, middle, and distal caudal femoral arteries. The proximal caudal femoral artery will arise most proximally and go underneath or to the gracilis, adductor, and pectineus muscle. The middle caudal femoral will go right into the semimembranosus muscle. I'm going to move this out of the way for a moment. We're going to continue down the femoral artery, and then we're going to be looking for a fairly large branch, although this cat has kind of a wimpy one, and that would be the distal caudal femoral artery. Once the distal caudal femoral artery comes off, our name changes to popliteal from main channel. In a cat, we can oftentimes see a caudal tibial, which we did not or were not able to see in the dog. And so once the caudal tibial arises, by definition, that name change will go to cranial tibial. That cranial tibial artery will then curve around the cranial aspect of the crus to run between the cranial tibial, long digital extensor, and fibularis longus muscles. Let's back up just a tad and look at a few of the other vessels that we skipped over. Up near about mid-thigh, we're going to look for an artery that comes superficially, and that is the saphenous artery, and it is going to be accompanied by the saphenous nerve, which came from the femoral nerve, as well as the medial saphenous vein. In a cat, the medial saphenous vein is much larger than their lateral saphenous vein. If I look, if I look more cranially at this vessel that's also superficial but coming to the knee. We're going to call that descending genicular. Genu means knee, and this artery is descending to the knee. And that should conclude most of the arteries of the pelvic limb. As we address nerves, I will mention some of the arteries for the gluteals.